I'm Dr. Eric Wechsler, board certified in internal medicine and nephrology and a fellow of the National Kidney Foundation. Managing chronic kidney disease is about more than protecting the kidneys. It also includes safeguarding overall health. Did you know that people living with chronic kidney disease are at an increased risk of developing opportunistic infections, such as herpes zoster? Today, I want to shed light on why this risk of herpes zoster is higher for individuals with kidney disease, how it can impact your patient's health journey, and the steps you can take to help protect your patient. Let's explore. First of all, 14% of US adults, about 35.5 million people, are estimated to have chronic kidney disease or CKD. But before we get into CKD, let's talk herpes zoster. Herpes zoster, also known as shingles, is caused by the reactivation of latent varicella zoster virus, or VCV. Primary infection with VCV leads to chickenpox. After recovery from chickenpox, VCV remains in the body and establishes latency in the nervous system. The CDC estimates 99.5% of people born before 1980 are latently infected with VCV. Here's the thing, years later, reactivation of varicella zoster virus can occur, causing a herpes zoster, which typically presents as a painful, blistering rash along one or two adjacent dermatomes. Symptoms may include pain, burning, itching, tingling, and deep aches, which can negatively affect sleep quality, work productivity, social activities, and overall quality of life. The most common complication of shingles is postherpetic neuralgia, or PHN, which occurs in 10 to 18% of cases. PHN is nerve pain that can last for months or even years after the rash resolves. Risk factors for herpes zoster include older age, being immunocompromised or immunosuppressed, being assigned female at birth, and having certain medical histories. In fact, herpes zoster can affect any adult who has been exposed to VCV, and the risk of herpes zoster increases with age. Common comorbidities that have been associated with herpes zoster risk include asthma, COPD, cardiovascular conditions, and chronic kidney disease. CKD can increase the risk of herpes zoster. According to 2023 estimates, CKD is more common in people aged 65 years or older than in people aged 45 to 64 years or 18 to 44 years. This helps us understand who to screen. CKD is also slightly more common in women than men and more common in non-Hispanic Black adults than in other racial ethnic groups. To understand why individuals with CKD are at increased risk, we must take a dive into how the immune system works in these types of patients. CKD patients have not only a reduced count of T and B cells, but also a reduced function of those same cells, in addition to an increased production of pro-inflammatory cytokines and uremic toxins. Data from a meta-analysis has shown a 29% increased risk of herpes zoster in patients with CKD versus without CKD. The CDC recommends herpes zoster vaccination for the prevention of herpes zoster and related complications in immunocompetent adults aged 50 years or older and in adults aged 19 years or older who are or will be immunodeficient or immunosuppressed because of disease or therapy. The National Kidney Foundation recommends that people with advanced CKD or kidney failure on dialysis get the shingles vaccination. Herpes zoster impacts more than 1 million people in the US every year. Raising awareness about shingles, its risks, symptoms, and potential complications is key to ensuring individuals with CKD have the knowledge they need to take preventative action.